Hi everyone, I'm Dr. Catherine Snow, and today I want to go over 5 infertility myths that you may have heard. Number 1, I'm sure many of you have heard the phrase, just relax and it'll happen. There's no evidence that relaxing in general will make you more or less likely to become pregnant. So as well-meaning as these phrases might be, they tend to stress patients out even more. So don't worry if you're not as relaxed as possible, because oftentimes when you're trying to have a baby, it's not a very relaxing experience. Number 2, as long as you're healthy, you can get pregnant at any age. Unfortunately, this isn't true. Women are born with all the eggs they're ever going to have, and so typically after 35, the risks of chromosomal abnormalities and issues in pregnancy do start to increase. After 40, they increase even more, and by 43, 44, it becomes very difficult to use your own eggs. So the sooner you know that you want to start a family, I do not recommend waiting until your mid-40s, even if you're as healthy as possible. Number 3, birth control causes infertility. We hear this all the time. I always tell patients that the type of cycle that you had before you were started on birth control is going to be the type of menstrual cycle you have when you stop birth control. Meaning that if you were started on birth control because you have irregular cycles, it's not uncommon for your irregular cycles to continue when you stop birth control. So do not think that the birth control is causing this to happen to you. Oftentimes, a lot of women are started on birth control at very young ages, and so they never really get into a menstrual pattern, and so they don't even realize that they are irregular until they're starting to be off of birth control. Number 4, well, my aunt or my sister had a baby at 43. More power to her. That's great. However, do not assume that just because someone in your family had a pregnancy when they were in their 40s, that it will be just the same for you, because every woman is different. And lastly, certain positions make you more or less likely to conceive. This is also something that's a myth. There is not one position over the other that has been tried and true proven to get you a baby. So do not stress yourself out that you have to do things a certain way. Please come see us if you need us. These are just some 5 infertility myths we wanted to bust on this Wednesday morning.